Hello, I'd like to introduce myself. My name is Mark Hammerberg. I'm one of the orthopedic surgeons here at Denver Health, and I'm one of the surgeons who does a fair number of our hip and knee replacement surgeries. And right now, the purpose of this video is to discuss just what is a knee replacement. I'd like to begin by saying a knee replacement is a surgery that we do. It might be one of the most frequently performed surgeries in the state of Colorado, if not nationwide. And why do we do it? We do it for people whose knees are worn out. They've basically worn out to the point that they've outlived their useful working life. It's kind of like brake pads on your car. They only last for so long. There are some people who are lucky enough to live their whole lives and not need any surgery, and then there are some people who have such bad knee arthritis that they've tried everything else. They've tried therapy, they've tried a cane, they've tried braces, they've tried medicines, they've tried injections. And while those things might work for some people, they reach a point where none of it really works anymore. And when none of it works anymore and your knee pain is so bad that it interferes with your daily life that you really can't live your life, you might find yourself, or you might find a loved one or someone you know, wanting to have their knee replaced. So I'd like to begin our discussion of what a knee replacement is by sort of summarizing what the knee is. Now, a lot of us know what the knee is, right? It's basically the joint that allows for motion between your thigh bone, which we call your femur, and your leg bone, called your tibia. And as you can see, here's your knee. Your knee basically, it can be likened to a hinge that allows full straightening or extension or bending. And inside the knee we have cartilage, which if you've ever eaten a chicken wing, you know that's that glistening tissue that allows for smooth motion at the joint. It sort of sits on top of the bone, and that allows for the smooth motion between the thigh bone and the shin bone or the tibia. We also have the kneecap, and the kneecap also is replaced as part of a knee replacement surgery. Okay? A lot of people say, oh, when they conceive of what a knee replacement is, they think perhaps maybe we're cutting the bone here and cutting the bone here and then throwing the knee out and putting an artificial mechanical joint in. Well, that'd be a reasonable thing to assume, because that sounds like a knee replacement. But in fact, what we're doing with a knee replacement is just replacing the worn out cartilage surfaces. There's worn out cartilage at the top of the tibia, there's worn out cartilage at the bottom of the femur, and there's worn out cartilage on the inside of the kneecap. So when we do a knee replacement, we're really not replacing the knee per se, we're replacing the knee joint cartilage. So this is a model representing what a knee replacement is. We don't cut the bone at the thigh and cut the bone at the leg and then put in an artificial mechanical knee. We simply take away the arthritic cartilage that lines the femur, that lines the tibia, and we put in these artificial components. And this is what it looks like. We basically prepare the bone. In the process of removing all the arthritic cartilage on the femur and on the tibia, we're left with a bone and ligaments that look like this. Most of the femur is still here, most of the tibia is still here, most of the ligaments are here. We got a ligament here, we got a ligament here, we have a ligament on the back. Then with acrylic cement, we cement the tibial component in place, we cement the femoral component in place, and when we do so, that femoral component articulates with this plastic here called polyethylene, and we have, where before we had an arthritic knee that was creaky and painful and didn't move very well, now we've got our artificial knee, or our total knee replacement, which is in effect replacement of the knee joint cartilage.